What is up, you guys? Today it is July 15th, and your girl is 29 weeks. Me and Thad finna go to our second childbirth class, so come along with us. So you guys, we just got here. We're a few minutes late, but it's all right. We made it.
We ain't the only one.
That's figures. We'll never be the only ones late.
You can start to find ways to incorporate more intentional relaxation into your daily practice. If daily's hard, weekly practice, a couple times a week, something. Remember, as we learn some of these different possibilities together of how to relax, how to access different comfort techniques and comfort measures leading up into being in labor and birthing, remember it's not like that light switch, like, okay, I'll do that in labor, right? We want to kind of be incorporating some of these practices little by little in ways that work for us as individuals, so that when we are in labor, it's that muscle memory. First stage labor, so we're going to pick up there. Okay. Here we have, it's called Penny Simpkins' Roadmap to Labor. Penny Simpkins is a well-known doula, educator. She got some books out there and things like that. So we're going to take a look at her roadmap to labor together. So we're starting pregnant, right? We're wondering when we will go into labor. Are we starting labor? So they're just walking along. They're pretty happy. It's hard to see their faces from away, but they're happy, walking along. Now we realize maybe we're in labor, right? Do we remember some of the signs of early labor? How might you tell you're in labor?
It's like a 5-minute, 511 or
511, that's good. That's kind of how we tell we might be moving into active labor. So early labor, how might you tell you're in labor? What are things that might feel? Your mucus plug, you might notice that it's come away. Okay, that can be a sign of labor. It's starting to happening, starting to get going. Anything else? Maybe we've been having practice labor contractions in our pregnancy, right? The final weeks and days of pregnancy. So how do I know that this isn't just practice labor contractions? How do I know that this might be labor taking off? What's a way that we could tell? Consistency. Okay. More of a pattern.
Right.
And
versus the Braxton.
yeah, we're on hands and knees on all fours. I imagine there's some movement here. She's not just stationary, frozen on all fours, but probably rocking and swaying or something like that. Here also leaning over the ball is another way to use the ball, not just sitting on it, okay? And we start to see, as we enter into what may be considered active labor, 6 centimeters dilated, starting to maybe use the water and be immersed in water, okay? Here we have, this mom is upright, she's at rest, okay? Maybe she's been quite active, walking around, and it's time to rest. There's a time to be active, there's a time to be at rest, okay? And here Penny Simpkins tells us rhythm is everything. So we're starting to establish our, ritual, what's working for us, finding our rhythm. As we really enter into active labor, that's where we're seeing the fruit of, establishing that, of finding that for ourselves. The rhythm is everything. Once we have a rhythm, it can help us from panicking, right? Okay, another contraction's coming. That contraction's done. I never have to do that contraction ever again, right? The next contraction's coming. I know what's been working for me. That's what we're gonna do. You physically can feel like the hardest part physically. Mentally, it can feel like the hardest part emotionally. It's also typically the shortest part of first stage, which is helpful, I think, to know. So we're on this whole journey here from maybe not being dilated at all to 3 to 4 centimeters dilated, 6 centimeters dilated, now we're in active labor. We went through active labor, now we're 8 centimeters dilated. We find ourselves entering transition. And, we could enter that fearfully, knowing that I heard that it's the most difficult part, the most painful part. We could also enter it knowing that this is the shortest part of labor. I'm very close to meeting my baby. I'm well supported. Here we see a lot of examples of support people stepping up. She calls it the take charge routine. We have our mom sitting on the birth ball. She's got an angry face in my little picture here. and the support person is saying, keep your rhythm, right? So like our words of encouragement, like you are doing well, you can do this, right? And all these different words of encouragement or words of affirmation that you may have been utilizing all along, now is really where a support person might find, we're gonna take charge, we're gonna step that up more because mom, I'm seeing mom needs it, right? Some of the most common things you hear from moms in transition, not just reflecting on the experience afterwards, but in transition is like, I can't do this anymore, right? I can't. That is a very common phrase if a mom feels she's experiencing a difficult transition. That's not a given that she'll experience a difficult transition. Some moms are like, I knew I was transitioning, but it felt like it kind of just flowed and then I was ready to birth baby. Come through transition, shifting from laboring to transitioning to birthing, and our body has given us kind of like, oh, I feel like I can do this. I don't feel like that, I can't anymore, nothing's working anymore. This is hopeless anymore. Often we can naturally find that second wind just comes over us and we feel energized to move forward and ready to meet our baby, okay? We're seeing demonstrated here some different possible birthing positions, pushing positions. Okay, this is the second stage of labor is what it's considered. So first stage is all of it. It's am I in labor, recognizing I'm in labor, going through all of it, all the way through transition. That is all first stage labor, okay? And then the second stage is as we're actually pushing and birthing. So there's a variety of possible positions, and we'll touch on that a little bit more throughout our time together today. So we see mom come and birth the baby, right? Here we have what she calls the epidural highway. She says pay the toll. She shows it as a paved road, right? So she chose all her visuals very specifically in this instance. We have that, yellow brick road, and then we have the potential rocky road of a slowdown, right? Here she shows for an epidural highway, this paved road. And the reason that that's demonstrated in that manner is because if we elect to have an epidural in any of our birth experiences, it may or may not be the wrong choice, okay? But overall, we do know the impact that epidurals can have on birth experiences. Once we select that, we kind of have, there's set protocols involved if we're selecting that. There's things that are kind of gonna happen along with selecting the epidural, which we will delve into a little deeper today about epidurals, pros and cons, and things like that. Now, everybody here is planning for a home birth, but in any birth, we don't know how things will unfold. So today we're going to talk a little bit more on medical procedures, things that may come up in a hospital birth. We're going to talk a little more on cesarean birth today, because if that should become part of your story, I hope that you feel you have at least the basics of understanding to move forward through that, to not be completely like, well, I was planning for a home birth, so I didn't learn anything else but any other type of birthing, and now that a different approach to birth has become part of my story, all these terminology, all these things are completely what is happening. It can feel overwhelming.
Active labor progresses into the third and final part of the first stage, called transition. During this part, your cervix thins and opens completely from 8 to 10 centimeters. The contractions during transition last 60 to 90 seconds each and are only 1 to 3 minutes apart. And birth. Laura has a short resting period after she's fully dilated, then feels a strong urge to push. Contractions are still powerful during the pushing stage, but less frequent. They will last 60 to 90 seconds and are 3 to 5 minutes apart. As each contraction builds, you'll usually feel the urge to push. The time it takes to push and give birth to your baby can last anywhere from 20 minutes to 3 hours or longer. At this point in labor, the top of the uterus is very thick and pushes on the baby with each contraction, helping the baby to move through the pelvis. Pushing in an upright position helps this process along and uses gravity to its advantage. Your baby's head will move down and then slip back slightly between contractions. To help your baby's head descend more easily, her skull is made up of separate bony plates. These plates slide together to help her head fit through the birth canal, giving many newborns a cone-shaped head after birth. Don't worry, this will only last a few days. Minutes after your baby is born, you move to the third stage of labor, delivery of the placenta. As the uterus starts shrinking, the placenta detaches. You'll feel another contraction as your body prepares to deliver it. Consists of the first few hours of your baby's life outside of the womb. During the third and fourth stages of labor, you'll probably feel a mix of exhaustion and joy. During the fourth stage, your uterus becomes more firm as it continues to contract and shrinks to about the size of a cantaloupe in the hours after birth. But you won't be back to your pre-pregnancy size for a while. Don't worry, as your uterus shrinks, so will your belly. Holding your baby skin to skin and feeding your baby within the first hour of life is shown to have a positive effect on long-term breastfeeding, milk production, and helps shrink your uterus to its usual size. Side lying, hands and knees, and sitting on the toilet early in the pushing stage, or sitting on a birthing stool if available. You might use several of these positions over the course of the pushing stage, and you might push in one position and then give birth in another. Keep in mind that certain positions aren't possible if you have an epidural.
What just happened, right? Like, they've been in their warm, safe, watery environment, hearing your breathing, hearing your heartbeat internally for months and months. And now it is, they can see light. Like, if you put a flashlight to your belly, your baby can see that. Like, if you put a flashlight to your hand, how the light is filtered, they can see that. It's different, though, being on the outside with these bright lights, and it's not so temperature controlled anymore, right? They just went on this whole journey of labor with you. However long you were in labor, they were on that journey with you the whole time, experiencing it from their perspective, right? The contractions were happening around them. So I always think of it that way. Like, if we can just ease them and encourage to promote this time of bonding and skin to skin, you can talk to them. They can hear your voice that they're familiar with. They can smell you, right? But the Montgomery glands, the little bumps around the areola, they emit, it smells like amniotic fluid to babies. There's 9 instinctive stages, whether you notice them very prevalently or not. The birth cry, we all look for that, right? To hear those lungs take in the air. Those lungs have been getting ready in these final weeks of pregnancy. The body, the baby's body makes a liquid to coat the lungs and make them ready to breathe outside of mom, right? But we look for that birth cry to hear that and to know, like, oh, okay, baby's okay, right? So the birth cry, relaxation. Baby kind of is typically sleepy, like this was a whole thing, right? The awakening, kind of like, wait, what is happening? Where am I? Why is it cold, right? The activity, we'll see them kind of like maneuvering a little twinges and things. Their nervous systems aren't super developed yet, so there's a lot of like reflexes and things like that. I love the newborn baby hands. Have we seen those? Where like as they move, they do that startle reflex. There's just, a lot going on with them. Then there's usually a period of rest. They're tired. It's a lot. It's all new. Everything is new to them. If we can remember this, not just for our brand new babies, but throughout their childhood, like everything is new to them. Like they don't know what that is. It's all new and exciting, right? So that they're resting. Then the birth crawl. Has anyone seen a video of this? The birth crawl. It's really cool. If you haven't seen a video, I encourage you to look one up. If we let babies be and we just support it, they will crawl to the breast within an hour or two of being born. They wiggle like a little worm. It's super cute. Their little head, like they look for the milk, they're smelling it and they're looking for it. So often in pregnancy, the areola darkens and enlarges. It's for the baby to find. And then the smell, the reason that the smell from what's emitted from the Montgomery glands smells like amniotic fluid, it's familiar to them. It gives them something to reach towards, right? And they will kind of wiggle and find their way and start to attempt to latch on. Early first stage, active first stage, transition, and second stage. And I'll show you cards and tell me where it belongs, okay? All right, let's start. I'm gonna start with these. So contractions being 1 to 3 minutes apart, lasting for 45 to 60 seconds long or longer.
Active first stage.
Active stage? Yeah. Okay, how about contractions 3 to 5 minutes apart, 60 to 90 seconds long?
It's transition.
Transition?
Mm-hmm.
How about contractions 3 to 5 minutes apart, 45 to 60 seconds long?
Early.
How about contractions 5 to 30 minutes apart, 30 to 45 seconds long? That's the last one, so I'll put it there. So that's not it.
That's not it.
So how are we gonna do it? What do we do?
The 60 seconds is second stage?
Which one? 45 to 60 seconds?
Which one longest? Which one longest? The 90-second one?
We have a 60 to 90 seconds long, contractions 3 to 5 minutes apart. That's at transition, and that is
Put that last.
Yeah, the 60.
What's the second one?
right now what we have with second stage or the second card.
The second card?
The second card we have here is contractions are 1 to 3 minutes apart, 45 to 60 seconds long or longer.
It's the second stage.
That's second stage.
1 minute apart, shortest.
So where do I put this? Contractions are 5 to 30 minutes apart, 30 to 45 seconds long.
5 minutes early stage.
This one's 5 to 30 minutes apart. We're putting this at early.
Oh yeah, yeah. That makes sense.
I think it should be in order by the time apart.
Okay. So do you need me to read them? Okay. So right now what we have early, active, transition, second stage. For early we have contractions are 5 to 30 minutes apart, 30 to 45 seconds in length. Okay, that is correct.
Yeah.
All right. Now second what we have is contractions 3 to 5 minutes apart. Right, so early first stage, we had them all the way down to 5 minutes apart. Now we have active first stage. Do we think the contractions are 3 to 5 minutes apart, 45 to 60 seconds long?
Yep.
Does that sound right? And then for transition right now, we have contractions are 3 to 5 minutes apart, 60 to 90 seconds long.
I feel like the 60, 90 is the active.
90. Yeah, switch them to.
These two?
Yeah, switch them to.
And then for currently we have second stages, contractions are 1 to 3 minutes apart, 45 to 60 seconds longer or longer. Transition?
That's the hardest part right there.
Yeah. So where do these go? Do we like where these are? So do we think contractions in active first stage are 3 to 5 minutes apart, 60 to 90 seconds long? And then contractions in second stage are 3 to 5 minutes apart as well, 45 to 60 seconds long.
I feel like we in business now.
We are in business now.
Transition.
Why might you say, here's another one?
Second. Oh, the early first.
Early first? I heard a no.
Oh, no, it's
Yeah.
Here's another one. Early first stage or second stage?
Early.
And then the last one is, wow, this is happening. I'm having
The
contractions.
switch.
Wait, yeah.
Yeah, you just said that.
Yep.
Wait,
She did.
you're like about to be pushing, like really pushing, so you're really timing your contractions to let them know, like, I'm ready to push again.
Mhm. So an early first stage where contractions are anywhere from 30 minutes apart all the way down to 5 minutes apart. That's all early first stage. That whole possibility of time, 30 minutes apart, 25 minutes, 20 minutes apart contractions, 15, 10 minutes apart contractions. This is all early first stage. Where might you place this, Mom?
She's a bear or a tub?
That. It's a tub.
Oh.
Transition.
Good.
Oh.
Active.
Active?
Active?
Yeah, but she can't get in before then.
Yeah.
Okay. How about our mom here? Let me see.
She's like in a fetal position.
Kind of, yeah, on her side, maybe curled up a little. Transition. How about our mom here?
Oh.
And our mom here.
Second stage.
Second stage.
Yeah.
Yeah, she's in there.
She's on all fours.
Yeah,
Pregnant.
yeah,
Okay.
for sure.
So we see our mom. Oh, is that a contraction? Right? A little smile. It's hard to see from far away, but she's smiling a little, like, oh, I think I'm in labor. I think it's happening. Excited, anxious, right? Wow, this is happening. Our mom here. I'm actually gonna switch.
I knew it.
This is my
I thought
transition
that.
mom. This is my I'm done mom. We're serious and focused here. We have eyes closed. We're holding a hand for support, right? We see where, our mom here was smiling, kind of acknowledging a contraction. She doesn't need to feel her belly anymore to know she's having a contraction, right? She's focused and trying to, promote her relaxation. Here, this mom, again, I know it's a little hard to see. Her mouth is open. She's kind of gripping the side of the tub, leaning back. I see she's tired, right? Like she might be feeling like a little frustrated at this point. And that's come over her. And then our mom here is on all fours. She's kind of shouting.
Be open to the fact that you might change your mind during labor, or there could be an unexpected medical issue. So it's a good idea to keep your birth preferences flexible. It's important to discuss this with your healthcare provider and labor support team during pregnancy. Why your caregiver might suggest inducing labor. If your pregnancy
Sorry,
continues
1 second.
too far past your due date, if your water breaks and contractions don't start on their own, or if your pregnancy puts you or your baby at risk. Inducing labor has risks, including an increased chance of cesarean birth, fetal distress, and increased labor discomfort for mom, which may lead to the use of pain medication. Because of these risks, it's best to induce labor for medical reasons only. In general, it's not recommended that women have their labor induced for reasons of convenience, such as wanting the baby to be born on a certain day, or to fit the schedule of a visiting relative. It's also not usually advised to induce labor before your due date because babies benefit from growing inside of the uterus for 40 complete weeks. In this segment, you'll learn about the two main types of pain medication used in labor, analgesics and epidural anesthesia. She requests an analgesic, which is a medication that affects the whole body. It dulls pain sensations, but does not get rid of the pain completely. The analgesic is either injected as a shot in the thigh or buttocks, or given through an IV line. If you decide to use pain medication, there are benefits to choosing an analgesic. You can receive it shortly after you request it, since it doesn't require an anesthesiologist. It offers pain relief immediately and does not numb your muscles, so you can move around after it wears off and push more effectively. However, analgesics also have some risks. They may make you feel drowsy or disoriented, which limits how much you can move around while they are in your system. They can also cause nausea and itching, requiring additional medication. An analgesic may slow down your breathing and lower your blood pressure. This is then treated with IV fluids and oxygen. Another thing to consider is that there are some risks to the baby. Analgesics enter the baby's bloodstream through the umbilical cord. This may cause slow or shallow breathing in the baby after birth. In this case, doctors might give him additional treatment and observe him more closely. Your baby might also be sleepy unless alert at birth, making breastfeeding more difficult. To having an epidural is being stuck in bed and not being able to use more productive upright labor positions. But with the epidural in place, you can still move from side to side once in a while. Changing positions helps your baby rotate into position for birth. Partners and support people. After the epidural has taken effect, mom still needs your emotional support, so stay close and provide words of encouragement. If she falls asleep, you should also take the opportunity to rest. There are several benefits to having an epidural. It offers very effective and safe pain relief. And it also gives you a chance to rest, which is welcome if you're having a long or difficult labor. Also, the medicine in the epidural does not affect your mental state, so you can stay awake and alert. Unlike an analgesic, the epidural has little known effects on the baby. The most common risks of epidural anesthesia can include shivering, fever, itching, and nausea. You could also experience low blood pressure, which may cause the baby's heart rate to drop as well, but is usually corrected by giving the mother extra oxygen, fluids, or changing her position. For some women, the epidural does not block all the pain. Very rare but serious medical risks are possible with epidurals and are listed on the consent form. Take note, since having an epidural can sometimes affect labor progress, it's generally recommended to wait until you are having regular contractions that are opening your cervix. Once you are fully dilated, it's best to hold off on pushing until your healthcare provider can feel your baby's head in the birth canal. An episiotomy is a surgical cut made to increase the size of the vaginal opening. Before performing an episiotomy, a numbing medicine is injected into the area to reduce pain. Since they don't offer substantial benefits in most cases, episiotomies are rarely done anymore. Talk to your healthcare provider about the risks if one is suggested. Common include a labor that's not progressing, despite using procedures to try and speed it up. When the baby's head doesn't seem to fit into the pelvis, and fetal distress, which is when the baby repeatedly has an abnormal heart rate. An immediate emergency cesarean may be needed if the placenta becomes detached from the uterine wall, if the baby's head pinches the cord blocking his flow of oxygen, or if there is a uterine rupture, meaning a tear in the uterus. An immediate emergency cesarean only happens in about 1% of all births. In the case of an emergency, general anesthesia is usually used. This means you are asleep for the birth. While cesareans are generally very safe, some risks to the mother include infection at the incision site or an internal infection, increased blood loss or hemorrhage, blood clots in the legs, injuries to organs, and increased risk of future cesareans. Risks to the baby include breathing problems that could require treatment and might mean that he is having a hard time transitioning to life outside of the womb, and in rare cases, injury during the surgical procedure. Makes a 4 to 6 inch horizontal cut to the abdomen, just above the pubic hairline. The abdomen is made up of an outer layer of skin and an inner layer of fatty tissue. The abdominal muscles and the uterus are beneath. During surgery, the layers of skin and fatty tissue are cut. These top layers are spread apart to reveal the abdominal muscles. The doctor separates these muscles by hand. You won't feel any pain when this happens, but you may feel tugging or pulling sensations. Next, these outer layers are retracted to expose the uterus. The surgeon makes another incision in the uterus and breaks the bag of waters if it hasn't already broken. The surgeon guides the baby's head away from the pelvis and toward the surgical opening, while an assistant applies pressure to the abdomen. Once the baby's head is out, the surgeon gently pulls the baby through the opening and she is born.
I hope you found it useful and hopefully you feel more confident in your choice to home birth or in understanding options that are out there in the world. What you're choosing, what you're not choosing, and what that all can look like. So that is all for today. Thank you for your patience in my overtime.
So you guys, the class is over. We leaving. Hope you guys enjoyed this video. Be sure to like, comment, and subscribe. And stay tuned for the next video.